What is emission? Emission begins with contraction of epididymis. Most of the time, these 20 feet long tubules in so small testiculars around the testicle. Epididymis is very important. The pain is very, even patient can't perform. Married couples, married people are number of these things. So doxycycline, remember, is the best. The Vas Deferens and ampulla to cause the expulsion of the sperm into the internal urethra. Then contraction of prostate gland followed by contraction of the seminal vesicle. No doubt, contraction of prostate gland, seminal, everything is expel their secretions, forcing the sperm forward. So that the sperms go forward and forward, come out. All this fluid mixed with the mucus from bulbourethral gland to form the semen. This is the semen. All this, the semen is not only sperms, that again prostatic secretions, other secretions, and all this to make these things. All process to point called the emission. The filling of internal urethra elicits the signal that are transmitted through pudendal nerves, that the nerves, sacral region, pudendal nerves of the cord. In turn, rhythmic nerve impulses are sent from the cord to the bulbocavernous muscles that encase the base of the erectile tissue, causing rhythmic wave-like stimulation. Okay, fine. That is why we ejaculate. Now this much you understand, that you can understand the very well what to prescribe, when to prescribe, what is the anatomy, what is the physiology is need in sexology point of view. Presentation online from current slide. Okay, fine. Now next is emission and ejaculation. We control sympathetic and parasympathetic role. Anatomy and physiology is over. Now other part is very important in anatomy and physiology of female. You should know. Female anatomy we will take in detail. At birth, what happens in female baby? 2 million of ovarian follicles are present. At birth of the female baby, 2 million of ovarian follicles. In the 2 ovaries, and only 3 lakhs remain at puberty. When the baby grow up and become puberty stage of the female baby, become a female adolescent, then out of 2 million remain only 3 lakhs. And further only about 450 follicles develop. After that, only best of that 3 lakhs, only 450 follicles expel the ovum during menstrual cycle. The remainder degenerate and other remaining degenerate. A single ovum is expelled from the ovarian follicle into the abdominal cavity in the middle of menstrual cycle. This ovum passes through the fallopian tube into the uterus. The most of the time you may get the problem that sometimes fertilization during that in the fallopian tube baby and that tumor is removed like that. You have to remove. There is a surgical line of treatment, no doubt. If the ovum get fertilized by the sperm, it implant somewhere, where in the uterus, where it develop into the fetus, a placenta and fetal membrane. All this helps to implant these things. Anterior pituitary secretes. There are now which hormones helps when. So you can remember here hormones, follicle stimulating hormone and luteinizing hormones which act on the ovaries. As a result, estrogen and progesterone hormones are secreted by the ovaries. The ovarian hormones are secreted at drastically different rates during the different part of the menstrual cycle. The duration of menstrual cycle is approximately 28 days and varies from 20 days to 36 days. Is considered as a normal. So don't worry. Most of the time, sir, 30 days is over. What happened? Don't worry. Take 10 to 15 days here and there. Wait and watch and will be normal. If delayed more, then you rule out PCOD. It's very common. Out of 10 girls, you will get 4 to 6 PCODs patient because of again problem of diet. Taking all more glycemic load increasing food like sugar made pizza, pista, or whatever pizza and other thing. These are the food particularly hampering the patient. Now, this was anatomy. Again, you should know what happened during menstruation. At the beginning of menstruation, the concentration of follicle stimulating hormone and luteinizing hormone increases. This FSH and LH increases. One of the ovarian follicle become highly developed and secrete estrogen. This developed follicle reaches the size of 1 to 1.5 centimeter. 1 centimeter to 1, just like 1 peanuts. At the time of ovulation, generally ovulation occurs 14 days after the onset of menstruation. The rate of secretion of LH hormone by anterior pituitary increases. Anterior pituitary LH. FSH level also increases. These two hormones act on the follicle and cause rapid swelling of the follicle, and luteinizing hormone has specific effect on the follicle. Estrogen level falls, but progressively there is an increase in progesterone level. As a result, ovulation occurs. How this ovulation and the role of hormonal therapy is explained here in this paragraph. After expulsion of the ovum from the follicle, the remaining mass of the cells is called corpus luteum. The corpus luteum secretes large amount of progesterone. How the progesterone secreted? After a week or so, the corpus luteum, just we will take this here. Oh, fine. What happened to this? Now, female sexual act. Like a male, the female sexual act depend on both psychic and local stimulation. Much of the natural sex drive is inhibited because of the social conditioning. Clitoris is especially sensitive for initiating sexual sensation. Sexual sensory signals are mediated to the sacral segment of the spinal cord through the pudendal nerve and sacral plexus. From the spinal cord, the sexual signals are transmitted to cerebrum. My dear friend, this much you understand the things so that you can ask the patient, those who want to plan for the baby, to have the intercourse between ovulation period, that is the mid of the cycle. First 10 days, starting phase of the first day is the 1 to 10 days. Don't worry, you can have the intercourse, but this is a safe intercourse. Those are young, those who don't want the baby. But if you want the baby, then you must have middle 10 to 20 days regular sex, alternate day or regular sex. And if most of the time patient comes to you, sir, our gynecologist said to have the intercourse, and from the next day I lost my intercourse because of tension and stress of performance, fear of performance. And most of the time, my dear friend, fear of performance, no other drugs better than the homeopathic drug. Simple. If you don't know about homeopathic, don't worry about that. Argentum nitricum is the drug what we are using in my clinic, and fear of performance reduced fantastically. Not about fear of performance of sex, fear of crossing the road, fear of doing the speech, fear of presentation, fear of these things. If have the fear of future, then you may need some drug changes according to repertorization of the homeopathic. Those are homeopath. We will take their repertorization session separately when I was in my OPD, so that you can understand how to go similumum, similar, similia. They were but similar, just like allergic. Yeah, modern allergy is the best or nothing but the is the presentation of homeopathic medicine. Normal vaccines are nothing but just like a homeopathic way. What the same. If you are the allergic to dust, they give the dust like that injection of the these things vaccines. The similarly, we give the dead tissue of virus of the vaccine. Similarly, homeopathic plays the role in some aspect about their treatment point of view. Anyway, parasympathetic impulses also pass to the bilateral Bartholin glands and cause the secretion of mucus inside the introitus. This and vaginal secretion. Many Bartholin gland present in the female, if you know this much, is more than sufficient. You can solve your MCQ very well. Most of the part. Most of the students don't know. They just write down yes, 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 or no, 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 like that. This and vaginal secretion provide lubrication during the intercourse. Please do sincerely. If you do the sincerely, MCQ is not for me. No doubt who are registered qualified doctors. So far we give each and every doctor's certificate. There is no problem of giving the certificate. But you should understand the things in depth and use in your practical in OPD cases. Then it is a value added program. Otherwise, what happened? I know, sir, everything and give me certificate. This is nothing. This is useless enough for I don't feel okay, you don't feel okay. What is the use? So, at least use your knowledge in the treatment. And it's a very good branch. You have to do very less. I'm hardly working 3 hours in 3 days in a week. Now in Corona, I'm getting this nearly 50%. No doubt, everything is reduced. But maintaining practice very well. The female orgasm is analogous of ejaculation in the male. Is similarly, previously what happened before 1960, Masters and Johnson's period after 1960. Before that, people think that male is made for the erection and female is a passive need for fertilization. That was the basic concept. Now this concept is changed by Master and Johnson. They studied their vaginal secretions, their emotions, their other factors, and they recorded the things, and people say, oh, now it's a thing that the role is equivalent both for orgasm, male and female partner. So whenever need the counseling, a single partner counseling, no use, need the both. So charge one partner and give the counseling both the partner. That motive you should keep in mind. Now we go ahead. What happened my slides? Now I'm not taking because more time. This thing, oxytocin is produced by the posterior pituitary. Now you know the anterior pituitary is secreting what? LH, luteinizing hormone, and follicle stimulating hormone, FSS, and oxytocin is produced by posterior pituitary. There are 2 parts of pituitary in the brain. Sometimes the patient don't know, even doctors, pituitary in the brain, Baba, not on these things, in the body, in the brain, inside the body, no doubt in the brain. Pituitary that helps contractility of the uterus, helping rapid transport of sperms toward the ovum. Means everything is related to your brain. That's why we say conscious mind, subconscious mind, unconscious mind. That is all relationship. 5%, 95% activate your subconscious mind, explore your mind, relieve your stress, relieve your hypertension, diabetes, control, like that. Means develop your conscious level, give the instruction properly ki I'm doing well, I'm happiest person. So your subconscious mind will ekdam relax. If your client getting sleep properly, you understand your patient is 80% normal. If sleep is disturbed, everything is disturbed. Because he is in the stress and tension. He evaluate the things in the counseling and treat accordingly. Sometimes happen, maybe people may leave you patient. Don't worry, they will come after some time patient will come me after going to the 8 to 10 doctors. Then again, sir, once I came to you 1 year back. No, sir, I am not really, now I am interested. Whatever you say, do it. I will do it according to what your suggestion, advice. That is a value added program. In such a way you can develop your valuation so that you can cure the patient, you will happy, and everything is based on how you take it sincerely and in meaningful way. Now we go to where we want to do these things. Why this is not working again? From currents. Now we will go for the discussion of OBD because of most of the things is over. I don't take your most of the time. Role of labia majora and minora is very important. Stimulation during the orgasmic level, stimulation by this fingering and all is important. Here see the role of stimulation in female. That is very important in during sensate focus. Most of the time patients say, what is sensate focus, sir? Even doctor said, what is sensate? Sensate focus, what is the sensory things? Yeah, the ear, hearing, nose, breath, smell, tongue, all these are sensory. And these things particularly is important in sensate focus to study the foreplay part. And labia majora and labia minora and clitoris role is 97%. Vagina role is only 14%. What I told you. Because the main organ, female sexual organ is clitoris, labia minora, you can say labia majora, and vagina is the least. 40%. It's just like a collapsible tube. I'm not taking much. You read it now. Now we go ahead. There may be 5 more. What these things? Anatomy chal raha hai. Okay, fine. There may be 5 or more sources of erotic satisfaction for the female. Realization that the partner, okay, tactile stimulation. These are the various stages. Generally, I will explain you how we prescribe sensate focus. We say even married couple, don't make haste. 2-3 days, just love each other, just chat each other, just hear each other opinion, and then slowly go for ahead. Only without touching to the sex organ, you can have this thing, stimulation of the body stimulation. If you get when the female partner hold your penile shaft in the hand, that time you try to introduce. Otherwise, no, don't make haste, because she come in orgasm, she love more, not your penile shaft, she love more in caring, in loving, how you handle your female partner politely and all. So that things is very, very important things. You must remember. That's why the female complaint will reduce. He came, he do tick tick tick, he's using me like a sleeping pills. These are the sentences of my female patients particularly. I don't like, he never given any gift, even flower in my birthday, whatnot, anniversary days like that. You try to give them what you need. At least hug them. You can hug. There is no spending of money in the hugging or showing your love. Affection is always better. Anyway, and breast, okay, fine. We will take these things. This need for the counseling sessions mostly. Now we take the most important